This is Just Nigeria coming up today. Controlling the spread of coronavirus in Nigeria, how to protect yourself to minimize risk of infection, and risking it all, the professionals who must work round the clock to stop coronavirus. Also, support for teen mothers in Tanzania as vocational center equips them with relevant skills. Plus,
my name is Chinasa Amadi. I'm a medical doctor, lifestyle medicine physician. Check me out.
The medical doctor passionate about helping our community to eat and live healthy. Welcome to Just Nigeria from the BBC and Channels TV. And here we'll look at the stories being talked about by the social media generation. I am Wale Fakile. Our top story today is in continuation of our updates on COVID-19. Now, as the number of reported coronavirus cases in Nigeria increase, the government has stepped up measures to help stop the spread. Schools, places of worship, international airports, and the country's land borders have been shut down. But are these measures enough to keep you from getting the virus? And how can you protect yourself and stay safe while preventing local transmission? Just Nigeria's Ajoke Ulodse has the answers.
The 2019 coronavirus was first seen in China's Hubei province. 3 months after, it's now in about 200 other countries. Although there are more than 30 cases in Nigeria, it's still difficult to ascertain whether local transmission has begun. But this is not the time to panic. Let's focus on how to stay safe and break the chain of transmission. Let's start with what coronavirus looks like. Coronavirus is a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with water, it rushes right over the virus. Also, when it interacts with soap, the virus is broken apart and becomes inactive. But it takes 20 seconds for this to happen. So, washing your hands for at least 20 seconds is the first way to keep yourself safe from the virus. To get your timing right, let's share a little trick with you. When washing your hands, try to sing the popular Happy Birthday song twice. Happy birthday to you. Happy birthday to you. Happy birthday to you, Joke. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday to you, Joke. Happy birthday to you. By the time you're done, you probably have washed your hands for about 30 seconds. It's that simple. But to achieve this result, you must wash your hands properly. Another important intervention you probably may have heard about is social distancing. Well, social distancing means you are not coming into contact with people unless you need to. It means you should work from home if you can, and if you have to be out in the public, avoid crowded places and ensure you stay at least 2 meters away from everyone else. Let's keep it simple. Imagine you're holding a big broom. You'll be a correct distance away if you can't touch anyone with it. Those who need social distancing the most are people over 70, anyone with an underlying health condition, and pregnant women. But really, everyone should do this. If you limit the contact you have with others, you reduce your chances of contracting the virus and passing it on. But how real can social distancing be in a country like Nigeria? Well, it's difficult, but not impossible. More often than not, we have all had to share our space with our neighbors, whether living in a duplex in your gated estate or a block of flats, better still, in a face me I face you as it's popularly called. So, how do you stay safe and break the cycle of transmission? A useful recommendation is to use your non-dominant hand for doorknobs, bathrooms, and around the space you share. That way, you don't use that hand on your face, eyes, or nose. Commuting in Lagos can be quite a bore, particularly if you are staying in a city like Lagos without a car of your own. Then you have to hop into a bus like this one and share your journey with at least 10 people. But how do you prevent contact? Scientists say the spread of the virus requires close contact. Hence, avoid sitting or standing too close to anyone. Also, avoid touching surfaces because they may have virus on them. And you can consider commuting at a time when there are less people on the bus. You should also wash your hands as soon as you get off the bus, or quickly rub your sanitizer before touching any part of your face. Now, the very idea of social distancing is to help keep thousands of people out of the hospitals at the same time, in order not to overwhelm health workers. But these are all preventive measures. So, what signs should you watch out for if you have been exposed? The two main symptoms of coronavirus to look out for are a continuous dry cough and/or a fever. If you are sneezing a lot, got a runny nose or a headache, you may be ill, but you probably don't have coronavirus. So, how high a fever is a coronavirus-induced one? And what exactly is a continuous dry cough? Well, it's when you cough and there is no mucus or phlegm. Basically, no gooey substance in your tissue. And it's not the odd cough here and there. It has to be coughing regularly for no other reason such as clearing your throats or smoking. How high a fever is a coronavirus fever? Technically, it's a body temperature of more than 37.8 degrees Celsius or 100 degrees Fahrenheit. But if you don't have a thermometer, basically you will feel hot, and your chest and back would be hot if someone touched you. Well, if you have all of these symptoms, it may be time to check out your risk level. There are tools online to check, so follow the simple steps and assess to classify your risk. If your symptoms get worse, it may be time for you to get in touch with your local healthcare provider. Please do not hesitate to call the helplines provided. Good news is, about 100,000 people have recovered from the virus, and research shows scientists are getting closer to a vaccine. While we wait, it's important to stay safe. Ajoke Hulotse, she's Nigerian.
All right, still on protecting yourself and others from the virus. The government has advised those who have the symptoms and those who have recently returned from high-risk countries to self-isolate for 14 days to prevent local transmission. So what is self-isolation and how can you self-isolate in a shared apartment? Have a look.
If them tell you say make you quarantine yourself, now you say you go sit down for house. You no go work, you no go school, you no go anywhere where people plenty. Most importantly, you no go allow anyone to come visit you for house. If you notice say your body they do you one kind, like say you get a cough or catarrh, carry phone and call the numbers where your government don't talk say make you call. No waka go hospital until they tell you say make you come. If you dey live inside house with other people, make sure say you choose bedroom wey get window where they carry breeze enter, they come out well. And lock yourself inside. If you dey share bathroom and toilet with other people, make sure say everybody don't finish before you enter. And no share towel, soap or sponge with any other person. Dirty wey you want to away, suppose dey inside 2 bags. If later test come out say you dey positive, now that dirty they go come carry throw away separately. If you dey live alone, make sure say you use internet to buy things for yourself or ask your friends or your families to help you. But they must leave them by your domot. The coronavirus they cause make some people no well for body. It dey affect 4 out of 5 people this way. The self-quarantine or self-isolation where you want to do will make sure so you know infect old people or people who already get sickness for body.